Achluophobia. Fear of the dark is a common fear or phobia among children, and to a varying degree adults. A fear of the dark does not always concern darkness itself. It can also be a fear of possible or imagined dangers concealed by darkness. Some degree of fear of the dark is natural, especially as a phase of child development. Most observers report that fear of the dark seldom appears before the age of 2 years. When fear of the dark reaches a degree that is severe enough to be considered pathological, it is sometimes called scotophobia or lygophobia. Some researchers, beginning with Sigmund Freud, consider the fear of the dark to be a manifestation of separation anxiety disorder. An alternate theory was posited in the 1960s when scientists conducted experiments in a search for molecules responsible for memory. In one experiment, rats, normally nocturnal animals, were conditioned to fear the dark, and a substance called scotophobin was supposedly extracted from the rats' brains. This substance was claimed to be responsible for remembering this fear. These findings were subsequently debunked. Nyctophobia. Nyctophobia is a phobia characterized by a severe fear of the dark. It is triggered by the brain's disfigured perception of what would or could happen when in a dark environment. It can also be temporarily triggered if the mind is unsteady or scared about recent events or ideas, or partaking in content the brain considers a threat. Examples could include indulging in horror content, witnessing vulgar actions, or having linked dark environments to prior events or ideas that disturb the mind. Normally, some humans are not nocturnal by nature. Humans are usually a bit more cautious or alert at night than in the day. Since the dark is a vastly different environment, nyctophobia produces symptoms beyond the normal instinctive parameters, such as breathlessness, excessive sweating, nausea, dry mouth, feeling sick, shaking, heart palpitations, inability to speak or think clearly, or sensation of detachment from reality and death. Nyctophobia can be severely detrimental physically and mentally if these symptoms are not resolved. There are many types of therapies to help manage nyctophobia. Exposure therapy can be effective when exposing the person to darkness. With this method, a therapist can help with relaxation strategies such as meditation. Another form of therapy is cognitive behavioral therapy. Therapists can help guide patients with behavior routines that are performed daily and nightly to reduce the symptoms associated with nyctophobia. In severe cases, antidepressants and anti-anxiety medication drugs can be effective to those dealing with symptoms that may not be manageable if therapy could not reduce the symptoms of nyctophobia. Despite its pervasive nature, there has been a lack of etiological reasons on the subject. Nyctophobia is generally observed in children, but according to J. Adrian Williams' article Indirect Hypnotic Therapy for Nyctophobia, a case report, many clinics with pediatric patients have a great chance of having adults who have nyctophobia. The same article states that the phobia has been known to be extremely disruptive to adult patients and incapacitating. The word nyctophobia comes from the Greek nyktos, genitive of nyx, night, and phobia, fear. The fear of darkness or night has several non-clinical terminologies: lygophobia, scotophobia, and achluophobia. Do you find this topic interesting? Comment below. Brought to you by Text to Video Learning.